I would like to open our event with an acknowledgement to country. Therefore, I would like to sincerely and respectfully acknowledge the traditional owners of the land, the Jagera and Turrbal people on which this event is taking place. I pay my respects to elders past, present and emerging. Today's event is a very exciting opportunity and comes in two parts. The first part is an expert panel presentation, and the second part, you'll have opportunity as a virtual audience to ask questions. Today's logistics, you can submit questions right throughout the event. Each question will be triaged and moderated. And just to note that all virtual attendees, your microphones will be automatically on mute. So that's enough from me. Let's introduce our expert graduate coordinator panel. This panel has a collective nursing experience of over 93 years and graduate coordinator experience of 25 years. We have Megan from PA, the newest member of our team, Helen from Logan, Redland and Beaudesert hospitals, and at the far end of our table, we have Renee from QE2. This panel cover the whole of Metro South and work strongly and collaboratively together as a team. So let's get into it, hey? Renee.
Thanks, Scott. So today we are going to be going through a presentation which is going to tell you a lot of information about our graduate programs for nursing and midwifery into 2021. We'll have a general overview. We'll go through the application process as well, and then we'll talk about some specific timelines that will help you on your graduate application journey. So we'll start by just talking a little bit about Metro South and who we are. So Metro South is a major provider of public health services and health education and research across Brisbane, as well as Logan, Redlands, and across to Beaudesert. We serve an estimated population of 1 million people, which is 23% of Queensland's population. So Metro South is a major contributor to health and healthcare for Queensland. We have 5 major hospitals within our service. These are Princess Alexandra Hospital, QE2, Logan, Redlands and Beaudesert Hospital. So today we're going to be talking about the graduate programs that are on offer within our health service. So I'm going to cross now to Megan Wise, who's going to talk a little bit about why choose a graduate program.
So why choose a graduate program? The aim of a graduate program is to assist a graduate nurse to transition from that beginning practitioner to a competent, efficient practitioner by providing structure, education and support. We really want to build on the fundamental clinical skills to advance your clinical skills necessary to become a competent practitioner. So what are you looking for in a graduate program?
This is probably one of the most important questions that you can ask yourself right now. We're going to spend 30 minutes today talking to you and telling you all about our programs, but it's imperative that we're meeting the needs of our future graduate cohort. So please, when you're going through your application process, think, what is it that I want out of my graduate program? What is it that I require? And hopefully through today's presentation, we will be able to answer all of your questions. And if not, we'll love to hear them at question time. So the application process, this isn't new for many of you out there. I'm sure a lot of you already have draft application processes existing in the graduate portal. What's important for everyone out there applying is that Metro South will only look at you if you have an application through the graduate portal. There is no backdoor opportunities for people to obtain a graduate program in Metro South. So it is imperative that you have your application through the graduate portal. Metro South does look at first preferences when it comes to your preferencing on the graduate portal. So if you would like to have an application considered by Metro South, it's important that you preference us first. Eligibility. Once again, guys, this isn't new to many of you who have had an opportunity to read through the prospectus on the portal, you will know that it is important for you to be considered at a graduate program in Metro South, that you are meeting the requirements set out by OPNO. So it's important that you have recently completed within 12 months, although you will note that the portal has said within the last 2 years, a nursing or midwifery undergraduate program. It's really important that you haven't been employed as a registered nurse for a period greater than 6 months. For those of you who are wondering why this eligibility criteria exists, this is important because it makes it equitable at interview. We want to make sure that people don't have a greater experience, which would disadvantage people who are only newly graduated. Of course, part of your nursing and midwifery eligibility to have a job in Metro South is that you are able to be registered with AHPRA, and of course our HR requirements stipulate that you must have immunisation, criminal history checks and identity checks performed prior to us appointing you a graduate program. This is what a lot of our applicants ask. A lot of our applicants really want to position themselves best in order to maximise their opportunities and obtain a graduate program. So this is one I want you to ask: what makes you different to your colleague who may be sitting beside you today or out there in the virtual space? What makes you different? What we see historically in applications is a lot of nurses and midwives beginning their application process saying that they are excited to become a nurse or midwife. This is expected, but what I challenge you to do is have a look and see what your own personal nursing or midwifery philosophy is and ensure that that is a part of your application process. When you're having a look, I know that there are some different requirements in order to keep CVs as simple as possible. So please make sure that if you're going over a word limit, please consider bullet points. Make sure that your font and italics is suitable for someone reading your application. And of course, your information needs to be meaningful. So please just don't list all of your placements that you have had in your student experience, but rather capture for the reader what it is that you gained out of that and how that has built you to be the professional that you will be when you graduate. Of course, a big one for us is professional communication. That means professional email addresses. Also from us, from a recruitment perspective, we'd like you to keep in mind that if you have a mobile phone, all of the people who will be ringing you or booking you for interview will be ringing you from a private phone number. So please, if you're not in the habit of answering private numbers during graduate recruitment time, it's very wise that you do that. We also recommend that you have an answering service on your phone that allows us as graduate coordinators to leave a message longer than 10 seconds. Everyone wants to know how to be the best so that you are maximising your opportunities. We want you to know that applications are ranked on a whole range of things. So yes, your cover letter, as I have said, is exceptionally important. When you have your cover letter, that is capturing the essence of you as a practitioner, so please make that important. Your CV, we always tell our applicants, do not pay for a professional CV. Your own personal CV will suffice, but please make sure you are capturing in there the elements that you have learned and what you have learned on those clinical placements. Short responses are required. There's one from OPNO. There will also be one from us as we move through in how we run our campaign. So please, once again, tailoring those short responses to the area and the type of nurse or midwife that is required to be in those areas will serve you best. Communication needs to be professional, and when it comes to your interview, where everyone thinks that that is the heaviest weight, your interview responses need to be concise, you need to be honest, and you need to ensure that you are demonstrating that you are a safe clinician. When we have a look at referee reports, Referee reports from Metro South will be accepted on any template. So we don't have any of the other requirements from any of the other HHSs. We will accept a referee report from on any template, but I also ask you, if you are unable to obtain the referee report on a written template, please confirm that your referee is willing to be contacted and have the correct details so that we can contact them should your application progress. Overall, if you were to ask us what we are looking for in Metro South, is a safe nurse and midwife who is willing to learn and grow and receive feedback.
Thanks, Helen. So I'm going to talk a little bit about the programs that we have available within Metro South. Thanks, Steph. So you'll see there on the slide, it says that Metro South has a wide variety of programs to fit your circumstances and career goals. And this is true. We offer over 50 different programs across our 5 hospitals within Metro South. So there is far too many to go through right now. But you can see there from the list, we offer programs that range from 6 months to 12, as well as 18 months. We offer full-time and part-time roles. We have rotational programs where you might rotate through 2 or more clinical environments, as well as non-rotational. Sometimes these are also called direct entry because you will complete your graduate program just within the one clinical environment. You can see there in the last bullet point, there are a lot of different graduate programs listed there, and we can't encapsulate them all here today. So what I would encourage you to do is, after our presentation, head over to our website and navigate around there. We have a lot of promotional videos that talk about our different hospitals and the programs that are available. And we also have some pamphlets as well. This is for individual hospitals and individual units. This is where you're going to find the information about what is available and what it is like to do a graduate program within that specific unit. What I would really encourage you to think about, as Helen has already touched on, what is it that you need from your graduate year? Consider what facility you would like to work at. Consider what kind of program and clinical environment that you would like to work in. We can provide the information to you to help you make an informed choice. But really, we would like you to take the time now just to really consider and really think about what it is that you need, because that's going to help you reach your goals and have the best year for your graduate year. Some of the structures that we have embedded in our graduate program that we are really proud of are listed here, and I'm going to go through them now. So the first few, orientation and unit orientation. This is across all facilities within Metro South. You'll have an opportunity to learn about the facility that you have applied for and been successful in a position, and a unit orientation as well. You also have supernumerary shifts. For those of you who are unfamiliar with this term, it means that you come to work, but you are above the ratio numbers. So you have an opportunity to have a nice soft landing into your job. You get an opportunity to learn where things are, learn who all the cool people are, and learn learn the workflows and things like that. We have paid education, which I'm going to talk about a little bit more on the next slide. One of the things that sets Metro South apart is our graduate support team. So you can see there we have graduate coordinators. This is an amazing resource that we are able to offer to you. It is our job across the panel here. It is our job to advocate for you as graduates in nursing and midwifery to ensure that you have the best opportunity to take advantage of learning opportunities throughout your graduate program so that you can achieve the most from your graduate year. Another part of our graduate support team is clinical facilitators, preceptors, and clinical coaches. These people are experienced clinicians who have had a specific training in how to work with novice nurses and novice midwives and help you achieve your best. Their job is to work alongside you in the clinical floor. We respect that when you start with us, you will be registered nurses and registered midwives and come with a whole host of clinical skills and knowledge. But let me tell you, that first time you have to do a skill such as a wound dressing on your own, it is amazing to have somebody that you know you can call just to ask for some help, step you through that process and give you some feedback. This is what is going to help build your confidence throughout your program and help you become the best nurse and midwife as you transition from a student. So on this slide, you can see a model of our education programs. So I mentioned previously that you have paid education. So we call these workshops or study days. What it means is that you come to work, but instead of going to the clinical floor, you will come to a classroom or a training environment, which is going to support you and help build you, not just with clinical skills, but also those non-technical skills. We appreciate that you have done a lot of training in your undergraduate degree, and those skills and knowledge can be consolidated on the clinical floor with your facilitators and clinical coaches. What we are interested in doing is building your capacity to be major contributors to nursing and midwifery within Metro South and building you up as the next generation of leaders for our district. A key cornerstone of this program is our Insight program. I'm going to hand over to Helen Maney now, who was instrumental in building this and implementing this initiative, and she's going to talk about it now.
Guys, Insight is something that Metro South is exceptionally proud of. It came about in 2017, and since its beginning, we have had over 100 graduate-driven quality initiatives that have existed across nursing and midwifery. Insight came about because we wanted to revamp our graduate program. We didn't want to retest undergraduate clinical knowledge, but we wanted to empower you to ensure that you had the skills, capabilities to initiate change within your workplace, understand organisational initiatives, and bring that wonderful vision that graduates have. Insight was chosen as a word because it represents that we have, you have fresh eyes and you enhance the vision of our service. So each graduate who is undertaking a graduate program across Metro South will partake in the Insight program, and it is so well received, and it gives you an opportunity to change clinical practice. We know that as millennials who exist in our workplace, if we aren't engaging with you in the first 6 months, you will leave. So the Insight program empowers you to make change, feel valued in our organisation, and we are so proud of the amazing results our graduates have given to our clinical floor.
So whilst we would love to continue to expand our knowledge and our program merits, possibly the best synopsis that we can provide you is our graduate retention data. So Metro South Health has retained employment and developed over 80% of its graduates right back to 2014, many of which are now in senior roles working as a clinical nurse or a nurse unit manager.
This is the bit you all want to know. Important dates are very, very important to our applicants, and we appreciate that. Up here you can see our timelines for our 2021 recruitment, and as you're aware, the portal will close on the 21st of August. This is a time that I am going to reiterate to you, your application must be in on the portal by the 21st of August. What will happen then, so that people have an understanding of the flow of your application, is that OPNO will cleanse the data which they receive, and then they will send it to the HHSs. Often our phone rings hot around the 23rd of August with potential graduates asking, what's happening with my application? What is happening is we're cleansing the data, we're making sure all of your information is present, and then it is emailed to Metro South. Because, as Renee mentioned, we have over 50 graduate programs, different versions of graduate programs on offer across Metro South, we can't follow the normal process. So what will happen, these dates could change, but around the 11th of September, you will receive an email from Metro South. This is when we are going to ask you to select an organisation within Metro South that you would like to be a part of. So you may choose PA, QE2, Redland, Logan, or by Desert Hospital. We will then ask you to choose 3 areas within those hospitals. I know a lot of you are saying, where can I find the information about who's offering which grad program? That is why we wait until the 11th of September, and you will have a list of areas within Metro South that are certain to offer graduate programs in 2021, so you are making an informed choice. Read that email exceptionally carefully. It will be asking you for a wide variety of documents, and it will be asking you to submit them in a particular format. The cutoff date, once again, like the portal, will be upheld. So if it is asking you to get your applications in at the 28th of September at midnight, that is when we will cut those applications off. What will happen then between September and November, we will have interviews conducted across Metro South. Now, Metro South prides itself on ensuring that we don't have group interviews. You may experience a group interview in order to be shortlisted for further interviews, but we'd like to provide an opportunity for all of our applicants to have an individual interview process. It could be a simulated interview, it could be a panel interview, it could be an interview station where you rotate through. But please rest assured, you will always be by yourself, and apart from a group interview in order to shortlist, you will not be with any other applicant. We expect that we will announce our graduate for 2021, our successful graduates, by the 1st of December.
So some useful contacts for you. As my colleagues Helen and Renee have highlighted, the portal is where you will submit your application. On the portal, please make sure that you review the recruitment prospectus. That gives some vital, important information of what you need to do to prepare your application. I advise to follow that to the T. We've got the APRA website, which you can refer to check your eligibility, and you can check your registration as well. We've got here our email address for the Metro South Graduate Support Team. Now, this email address is also available on our website. On our website, as my colleagues have mentioned, you'll find the videos of the clinical areas, you'll find pamphlets as well. We'll also be giving some generic announcements on where we're up to with the recruitment process, just to keep you all up to date.
Thanks, guys. Great work, team. We're going to now be moving along to the second part of our virtual open day, which is our live Q&A component. We've already had a number of questions come in, remembering it's not too late to submit your questions. Our first question is definitely a frequently asked question, and that's, do you consider a GPA score for your eligibility criteria? Is that the bottom line?
What a GPA represents to us here at Metro South is that you are very good in academic land. Nursing and midwifery is not about academic land. It is about making sure that you are a safe practitioner who's willing to learn, and by learning you receive feedback and you grow and you put that feedback into place. Of course, GPAs may come into play when it comes to shortlisting. Please remember that critical care areas are very highly preferenced, and there is an expectation in Metro South that we will support you with ongoing postgraduate learning, which occurs through the transition modules. So some areas may look at GPA as a reflection of your commitment to ongoing learning.
Lovely, Helen, thank you. Our second question that's been submitted, I understand 2 referees are needed. Do both of them need to be a clinical referee?
I'll fill that one, Scott. So you do need to submit 2 referees, that's correct. We only require one of them to be a clinical referee. So we do require at least one to have been somebody who has supervised you in your nursing or midwifery clinical placement practices. So please make sure you contact those referees and get their approval to put their name down as a referee, because this will be important.
Please don't underestimate your non-clinical referees. There are so many jobs that you may have out there and people who can speak on your character. So please, skills if you're manager at McDonald's, or can talk to your communication, your personality, your ability to learn, your ability to receive feedback. All of those things actually occur and are transferable skills that many of your employees will be able to speak to. So please don't underestimate any of the jobs you have out there and your manager's ability to provide feedback suitable for a clinical environment.
Lovely addition, thank you. We've got a third question coming in, but the synopsis of this question, do you want us to write a list of knowledge and skills and abilities in the graduate summary? Or would you refer your examples to showcase your abilities of placement or work? Do we want bullet point list, guys, or do we want a skills and ability comments within our submission documents?
I think the most important thing is when you're looking at any opportunity, whether it's on the graduate summary, in your CV, in your cover letter, is to make the information meaningful. So we appreciate that in your undergraduate clinical placements, in nursing and midwifery, you have experience in a variety of different units and learnt skills and knowledge. A list doesn't necessarily give a lot of meaning. So I would encourage you to consider how can you showcase that information in a meaningful way.
I think sometimes it's good to give an example of how you can demonstrate that caring. So examples you've had from a clinical environment, and put that in your response. That can be very meaningful because we can see how you're thinking and how you practice.
Also what you've learnt in those areas, particularly if you are applying to those areas. So what you've learnt, how you've changed your practice, reflection is key, and we want to see that you've incorporated that and developed yourself because of it.
Our next question is a referee question. Which is better, a clinical facilitator or buddy RN in placement?
I would think it would be someone that you've worked closely with in the clinical environment. So, you know, whether it is that preceptor that's giving you the feedback, or you choose to have a clinical facilitator, that would be my response. Yeah.
Metro South does value the voice of the clinical floor. We do value group fit. So of course, if you're applying to an area and you have worked closely with a nurse or midwife and they have offered to be your referee, that speaks volumes about you as a clinician. It also speaks volumes about your fit within the organisation. So please, if it's offered, take it up. I always tell graduates or potential graduate applicants, you have the ability to triage your referee reports. So if one comes in and it trumps the other one, you can triage that to your third referee report, but know that you're submitting your two best referee reports forward. A lot of people think, oh, is it great that I've got the NUM? But I'd like to reiterate what Megan has said. The people who are working with you on the clinical floor who can provide an overview of how well you have performed, that is what is important.
Our next question I'd love us to answer because it talks to some of those nuances of the Metro South graduate campaign and talks to a dual degree graduating nurse, graduating from nursing and midwifery. I put down midwifery as my first preference, followed by paediatrics and then medical nursing, but that's not the case. Helen, how do we?
Yeah, we've worked very hard since dual degrees programs have come about, because we have advocated quite strongly as a graduate team that as both a nurse and a midwife in Metro South, you are eligible to have two applications. So you have a nursing application and you have a midwifery application. So for our person who asked the question, Metro South doesn't make you choose. You can have two live applications going. You may get to go to two sets of interviews, but what will happen is that if you're successful at both, you then make the choice on whether you want to consolidate firstly in your nursing or midwifery. So what I would say to you as any of our dual degree nurses and midwives, Metro South has fought hard. You don't have to choose. We see them as two very different professions and would like to offer you the opportunity to consolidate in both.
Lovely. Do you consider second or third preferences at all, or only your first preference? I assume that means clinical preference?
Yes, so within Metro South, to keep it fair and transparent for everybody that applies, we only have one application. Now, just picking up on what Helen said, if you have a nursing and midwifery, you will have an application live in both of those campaigns. But we will first send your application to your first preferenced area for the manager of that area to review and shortlist. So if you are successful in your first preference area for an interview, that is where your application will stay. If you are unsuccessful to be shortlisted for an interview, then we will move your application to your second preferenced area and so on.
Just a reminder for the audience that our campaigns, particularly when it comes to interviews, move at different times. So if your first area of preference interviews after your second area of preference, we won't have the ability to move it around. What we do have the ability to do is have a look at your application, gauge a good understanding of where your areas of interest lie, and keep it live across Metro South where interviews are offered.
Yeah, lovely. Our next question actually comes from Connie, who wants some clarification around the graduate summary process. Could you expand on how you would like us to answer question 2, which is, please outline why you gave preference to your chosen hospital and health services. What type of things would we like to see in our health and hospital service short answer question within the graduate summary?
Well, I can start off. I think that's referring to having got the websites and seeing what hospital would offer to you to your graduate program. So is it that you want to come to PA where we're a magnet hospital, what's the ethos is from each hospital?
Yeah, definitely. Have a look at the professional practice models that exist for each of the hospitals. That information will be included in all of the brochures that exist on the website. The other thing that I want you to do there, Connie, is you will know in your heart why you want to work at a particular hospital. It's your opportunity if you've been on prac and you've seen great teamwork, if it's the actual collective community in which that hospital or health service serves, that can also be a telling reason about why you are gravitating to one particular hospital or one health service. So I'd love to be able to give you the answer for yourself, Connie, but what is important is that you have a look what is it, whether it's teamwork, whether it's ethos, whether it's your PPM, whether it is serving a particular community that is important to you, or the professional development opportunities that will exist for you in each organisation.
I think it's also really important to add, just considering the headspace that you guys are in right now in university, finishing off, your graduate summary, your CV, all the documents that you submit to us, they are not assignments. There is no right answer. The best thing that you can do is, like we said, reflect on what it is that you need for your graduate program and find a way to share that with us. Make it personal. So bullet points are okay, but you don't need to provide referencing or anything like that. It's not an assignment.
Yeah, very thorough answer. Thank you, guys. Our next question comes from Audrey, who's wanting to clarify hospitals that offer more than one graduate program in a clinical area. For example, PA offers several medical graduate programs. You might be interested in medical or cardiology. How do we go about that process within Metro South?
So for this year, we're going to do a divisional approach for this health service. What we will be asking for when we put our preferences out, that you identify an area that you're particularly interested in.
Yeah, and once again, guys, stay very much focused on, you will have a list of all areas that are offering graduate programs in 2021 provided to you once we have you as our first preference. That way you can make an informed choice about what areas are offering graduate programs to you.
And I think we need to acknowledge that you're at the beginning of your career as well. So, we want to get you in and get you started on a graduate program, and the world's your oyster then from when you go on.
Lovely. Our next question looks to be a clarifying question from our presentation. It describes what is OPNO, but I think they might be asking what is OPNO that might have been provided as a part of our presentation today.
Yeah, sure. So OPNO stands for the Office of the Chief Nurse and Midwifery Officer, and they are the government body that we look to as part of nursing and midwifery, and who is what's the word? Not control, but the portal.
They run the portal.
Run the portal.
So they're the
That's what
owners
they
of
do.
the
Overall
portal.
governance.
Yes, yeah. So when we say that acronym, that's who we mean.
Yeah, lovely. Cheers, guys. That's a good clarification from our presentation. Our next question is definitely a frequently asked question. My question is that do international students, can they apply to the program? And asking around valid visas and nursing graduate visas. So do we accept international applicants to our Metro South graduate campaign?
This is a great question. We get it every year, and we would like to clarify right now that absolutely yes, if you are an international student on a student visa, you can apply to the graduate portal. Remember what Helen said at the start, if you do, all applications must go through the portal. So we appreciate, as this person has asked, that you're currently on a student visa. Now this will change, won't it? You won't always be on that visa, and you can update that information in the portal at any time. Metro South has a strong history of reviewing applications from international students once those visa status has changed. But I strongly encourage you, do not listen to anybody that says you can't apply. Please apply. We need that application from the portal to be able to look at your application.
Lovely. Our next question is from Stephanie. Stephanie, is there any weight given to previous EEN experience?
Little great question. Now, Stephanie, we're going to see a range of applicants come to us, and it's hard because you're not in the room, so I can't ask the clarifying question, which is, are you an EEN in Metro South? So what I would like to say to you is EEN experience is going to assist you in answering your interview questions. If you're employed in Metro South, you're going to have an understanding of the organisational initiatives and you're going to have that inside knowledge. We do not give preference. What we do is we rank all of our applicants on those 6 criteria. But what you will have is an advantage of working in healthcare, an advantage of having healthcare referees, but it does not mean that we give you preferential treatment. Each applicant is looked at on their own basis and are reviewed accordingly. Can I please say to any EEN out there, enrolled nurse or AIN, when you come to your interview, please remember that you are answering those questions as a registered nurse. For those of you who are not EENs or AINs, you may think that they have an advantage, but it is imperative that when you go to interview, you are answering as a registered nurse.
Yeah, lovely answer. Our next question is possibly an expected question. I was wondering if COVID has affected the graduate program intake for 2021. And that's the synopsis of that question. So has the pandemic impacted any of our opportunities for our 2021 graduate program?
Look, that's a great question.
It is a good question. So I suppose we need to look at this campaign as a 12-month campaign, and we'll be looking at the numbers continue looking at the numbers.
Yeah.
Moving forward.
So all graduate positions are driven by workforce needs. So each area is reviewing what their workforce capabilities are, but as Megan alluded to, it is a 12-month campaign and we may see our graduate numbers increase as we progress throughout 2021. One thing that COVID did provide was a wonderful opportunity for people who did have applications on the portal. So in previous years, Metro South has not exhausted their first preference list. But hand on heart, in 2020, we did exhaust that list, which means that for those people who are graduating in 2021, you will not see the carry on of a previous campaign with people reapplying to the new campaign, as the majority of people on that 2020 first preference for Metro South has been exhausted.
Yeah, well said, Helen. I think the pandemic is a very dynamic space, but the good news is our recruitment processes across Metro South and opportunities is also a very dynamic space as well. I'm going to skip the next question. We're running shortly out of time. I'm going to jump to the question after that is, I'm graduating mid-year next year. Can I apply for the graduate program now?
And we say no. The reason why we say no is hold your application until you have graduated. That way, because you are putting yourself 6 months behind your competition and you're not eligible to start when we see our historically our large numbers of graduate programs commence, which is in the January, February to March period. So if you hold over till next year's campaign, I can appreciate that it'll be July in which you graduate, and then you'll move to waiting till August for the portal to open. But if you wait until August, that will keep you competitive at interview, and you won't be up against people who may have had 6 months nursing experience or midwifery experiences, as well as 6 months of their undergraduate degree knowledge already consolidated.
The last question that we're going to take as a part of today's format is, would you accept the referee report in last year's format filled in currently? So will we accept the July 2020 referee report?
Generally, we like all referees' reports to be written within 6 to 12 months. So if you do have a report that's over that, I would strongly encourage you to contact your referee and just ask them to update it.
We also have an obligation as an organisation to check all referees. So as long as those contact details haven't changed in the last 12 months, we can ask the applicant over the phone to verify that this is what they have said about you, and to ensure that that is still a current opinion that is maintained by them.
And I think it's very important to make sure that your referees know that they're down as a referee. So when we contact you, they're aware and they're able to give that recent information as well.
Lovely, guys. Unfortunately, that was our last question, as mentioned. But I'd like to make some special thank yous as a part of today. I'd like to thank Jordan, who's been in the background moderating some of our questions and feeding them through to our expert panel. But I'd especially like to thank the Metro South Media and Comms Department for making this event a possibility. And of course, a thank you to our virtual audience for joining us today. For those that might have joined us late, this recorded session will be available on our website at a later stage. And on behalf of the panel, one of our last messages, we'd like to wish all graduating nurses and midwives all the best for their career, regardless of the health service or context in which they're employed. Thank you for joining us today.